Okay, so first of all, I am a firm believer in spreading awareness about important medical conditions. And in this case, I feel like I need to give a little bit of advice. I give my kids the same advice. Get copies of your lab work. They run tests. You don't have a copy. You can't fact check your diagnosis. Point being, my physician didn't even tell me about my lab test results. I had to find them on my patient portal. And it's a devastating disease from what I can Google. Still hasn't called me. So that's my advice. I have other words of wisdom too. Stay tuned. On this episode of Minnie's World, Minnie gets diagnosed with a rare autoimmune disorder, and she kind of has some advice for you. So after discovering this information on my patient portal, I decided to go out to breakfast with my teenager, and boy, did that cheer me up.
All right,
Here's what happened.
Week's episode of Minnie's World is about Minnie's new diagnosis. If it's rare, I always say if it's rare, I'm gonna get it. I got it.
I just can't wait for this cake to come.
Oh yeah, I'm gonna eat some of that cake. Now back to me.
There's still more cake.
All right, Noah, I know you're enjoying your cake. In the middle of a Minnie's World episode right now. You just read about my diagnosis. What do you think about it?
Wait, I forgot my lines. Let's just go with that it fucked, okay?
What?
I don't know, I forgot my lines. We're just gonna go with your fuck.
Too old for what? I can sing. I can break out in song.
You
know,
just
that's
said break out
that's
in
re-
song. You just proved my point. Like, nobody in 2022 said, I'm gonna break it down.
I didn't say break it down. I said break out in song.
You should have just stuck with what I said. That's what it was.
Okay, advice number 2. My daughter is going through this, my adult daughter. She has a lot of symptoms, and sometimes they want to just label you with fibromyalgia. You're a woman, they want to say, it's in your head. Okay, they do not automatically run tests for vitamins. A lot of people don't know that. You're like, I got my physical. It should all be there. No, it's not all there. Is if you have crazy symptoms that cannot be explained and the doctors are scratching their head, like they do with me all the time, I call myself Medical Mystery Minnie. And that's the truth. So it may be autoimmune related. And in that case, they have to run special testing for antibodies. So advocate for yourself as a patient. Do as much research as you can before you go in and load them up with questions and make them do their job.
Come on, break out in song. Now see, that's just break out in song. Let me hear it.
Okay.
You gotta stop eating blocking out though. You can't sing with your mouth full. Ooh, ooh, ooh. Wait, I like this song too. I might break out in song on this one too. Name was Lola. Ooh. Wait, now I'm just breaking out in the dance. Look. Noah.
Don't make me hate my life even more.
Oh, I was eating ice. This is on. Okay. Hold on. Advice number 3. Okay, this is a sensitive topic. Okay, if you have any substance intake, how about that? Alcohol, I don't know what else ever you might be taking. That is their first go-to. They'll be like, hey, well, you are doing this particular substance, in my case, martinis. Okay, and they will say, well, this is the reason for your symptoms. Go home. Completely stop doing that. I'm going to give up my glass of wine for nobody. All right, so meanwhile, You got to look out for that because it's the easy go-to depending on what your symptoms are. They'll be like, hey, if you just stop doing this, you'll be healed.
Wait, it wasn't recording.
I don't know who's higher, you or me.
I don't get high. I'm naturally high.
And shit, must be me.
Advice number 4. 4. 1, 2, 3, 4. Do not be afraid to walk away. Walk away. If the doctor is not treating you with respect, my daughter is going through this right now, and they are not, seeming competent to you, although you're not a physician, but you know and you can tell if they're not being thorough, meaning you're in, you're out, you're in, you're out, and you have all of these symptoms happening, and they're not being compassionate, and they're just going, well, come back, I'll follow you, come back in 4 weeks. And you go back in 4 weeks, and I'm like, well, yeah, I still haven't figured it out, come back in 4 weeks. Do your research, find a different doctor, find a specialist. From my experience, a primary care doctor is usually going to refer you out if you have special symptoms. I'm special.
You're gonna kick me out of here.
Like they did in the hospital?
Well, I like this oldie but goodie song. Ooh, jukebox. Alright, 2 seconds, I'm gonna break out. Family. We're family, Noah. I got all my sisters and me.
Okay.
I'm embarrassing you.
Okay, advice number 5, final advice. Don't be like Minnie. I'm always going AMA. I don't have the patience. Stuff goes wrong. I end up taking out my IV. The time prior to the last time didn't end up so well. I will spare you the gross details. But this last time, it kind of went off without a little tiny hitch. Stay in the hospital. Follow their advice. I'm just saying. That's the best thing to do. If you're in the hospital, last time I was in the hospital, this is the doctor that sent me there who never gave me my test results, and then their MRI machine broke. I was there for an MRI, and if you look at the last Minnie's World episode, they drug tested me without my permission. Like, who does that? Of course it was all negative. I don't do drugs. But they didn't know that. Maybe I act like I'm on drugs. All right, I'll try this again. Hopefully we won't have blood spurting everywhere like a volcano. I'm breaking out of this place. I don't have the patience for them. Taking this out myself. This is how you take out your own IV. Uh-oh. Okay, hold on. This is when you don't have the patience to wait for these fuckers. Uh-oh, this could be bad. This could end badly. I might need a little bandage thingy. Oh, shit. So, meanwhile, I go to my neurologist and follow up. And he puts me through this grueling nerve conduction study. And it is like an hour long, which I end up stopping halfway through it. I'm like, look, you're done. You should have enough answers. This is enough torture. Like, come on. And, he's looking for the lab work. And he's like, I don't see the lab work. I'm like, it's like, I don't know. I was in the hospital. They ran lab work. Couldn't find it. I come home after the appointment, find it on my patient portal. And I'm like, what the hell? It's like right here. And so this is what it is. Devic disease, or also known as neuromyelitis optica, is a rare yet severe demyelinating autoimmune inflammatory process affecting the central nervous system. It specifically affects the myelin, which is the insulation around the nerves. It mainly affects the spinal cord and the optic nerves, but it also can affect the brainstem. It affects the nerves that carry signals from the eyes to the brain. As a result, the disease can cause paralysis and blindness. So what I'm gonna do, what the hell is up with this lighting? The hell, the what, the when, the where, whatever. Just take my mind off of this. Seriously, it's distracting. Oh, that's better. Take my mind off of everything. My birthday's coming up. Yeah. I don't know. I'm gonna do something fun. I don't know what that is yet. Maybe that'll be a whole nother Minnie's World episode. But until next time, guys. See you soon.